Today we'll review the basic functions and workflow of the Welch Allyn Connex Vital Signs Monitor from Baxter. We'll cover how to navigate the device interface, take a set of patient vital signs, and begin continuous monitoring. The Connex Vital Signs Monitor, or CVSM for short, is a multi-parameter patient monitoring device that can measure non-invasive blood pressure, temperature, SpO2, pulse rate, EtCO2, and 3 or 5 lead ECG on adult, pediatric, and neonatal patients. The device comes standard with our Sure BP non-invasive blood pressure technology, which measures the patient's BP on the inflation of the cuff. It can also be configured with different temperature and pulse oximetry options. Temperature options include oral, axillary, and rectal, with the Welch Allyn Sure Temp Plus, or tympanic with the Braun Pro 6000. Pulse oximetry can be configured to accept sensors from either Nellcor or Masimo. Now let's review the physical device and the software user interface. To power on the device, push and hold the blue button on the right side of the device. Once you do that, a small light next to the power button will flicker, and the splash screen will appear as the device undergoes its boot-up process. The power light will glow green when the device is fully charged and/or amber when charging. If the device is already on but in sleep mode, it can be reactivated by just touching the screen. The Connex Vital Signs Monitor contains 4 profiles to acquire patient vital signs: Spot, Office, Intervals, and Continuous. We'll cover more on these profiles as we progress, focusing on Spot, Intervals, and Continuous. To navigate between the profiles to select which works best for your workflow, select the profile icon at the top right of the screen. Select the desired profile, and then click the Home tab. Now let's walk through the different sections of the device screen. You'll see that the interface is broken up into 3 main areas: the status area, content area, and navigation area. These are common across each of the profiles. The device status area on the top contains a clinician ID, name of the device, a clock and battery status indicator, profile screen selection button, and if connected, a connection status icon for connectivity to the EMR or central station. This section is also where any visual alarms and device messages will be displayed. The content area, or the middle portion of the screen, is where your clinical parameters and custom modifiers reside in a tiled format, each with their own unique color. The CVSM can accept up to 20 manual parameters, some which are essential for the device to calculate an early warning score, if applicable. In the Spot and Intervals profiles, you will see Clear and Save buttons here as well. Clear will delete the current readings on the screen without saving them, and Save will also clear the screen, but save the measurements into the Review tab for future reference. Or the Save button may say Send and transmit the vitals on the device directly into the patient's chart within the EMR. Lastly, the bottom section of the screen is referred to as the navigation area. This contains tabs that allow you to gain access to patient data, as well as advanced clinical and administrative settings. Now that we've reviewed the basic layout of the user interface, let's spend some time reviewing the most common profiles used in the acute care setting. The Spot Check profile is optimized for taking a single set of patient observations. Before taking any measurements, it's important to select the proper patient type at the bottom center of the home screen. You can toggle from adult to pediatric to neonate by simply pressing the patient profile button. The age ranges for these patient types are neonate, fewer than 28 days, pediatric, 29 days through 12 years, and adults, greater than 12 years of age. Based on the age of the patient, the proper cuff and blood pressure hose may change. Consult your instructions for use manual for further details. Adjusting this button will alter some of the clinical parameter thresholds, such as maximum inflation rate of the blood pressure cuff. Once you've verified the patient type, you can continue with your measurements. If connected to the EMR, you may be using a barcode scanner for clinician sign-in and patient identification. If so, first select the clinician icon at the top, then scan or tap your clinician ID. You'll see a value display, and then select Sign In. To identify the patient, scan their barcode when you're on the home screen, and the patient name and/or ID will display on the bottom of the screen. To take a blood pressure, use the range indicator on the cuff to determine the proper size. If 2 cuff sizes fit the patient, Use the larger of them. Make sure to place the cuff on the bare upper arm, aligning the cuff marker to the brachial artery. Apply the cuff snugly, allowing room for no more than 2 fingers. Snap the fitting from your blood pressure device directly into the cuff and wait for the click sound. Once the patient is fully situated and the cuff is applied, press the Start button on the NIBP tile to initiate a singular reading. The cuff will inflate with the SureBP algorithm and capture a measurement on inflation. If the device detects motion or artifact, it may default to step deflation in an effort to obtain a reading. To take an oral temperature measurement, place the probe with probe cover in the sublingual pocket of the mouth. The sublingual pocket is located beneath the tongue on the inside of the gums in the back. Once the probe is properly placed, the thermometer will cycle, and once it's complete, the device will beep. Dispose of the probe cover and set the probe back into the probe well. The SureTemp Plus technology in our temperature probe contains a preheated filament that reduces the time to take a reading by bringing the probe to body temperature prior to measurement. The SureTemp thermometer can also be used to obtain axillary and rectal temperatures. For rectal temperature measurements, a different probe and probe well is required. To switch between these measurement methods, there is an icon within the temperature tile. When pressed, it will change between oral, pediatric axillary for ages 17 and under, and adult axillary mode. Please note that rectal mode can only be accessed if the appropriate probe and probe well are attached to the monitor. Once connected, the rectal icon will appear automatically. To distinguish between oral and axillary thermometers, refer to the color. Blue is for oral and axillary measurement, red is for rectal. Next is pulse oximetry. To achieve a proper SpO2 measurement, make sure you have the right size sensor for the patient. Use a clean, dry site where the sensor will be placed. Heavy lotions, sunscreen, dirt, oils, and nail polish may alter its accuracy or secure placement of the sensor. To ensure proper placement of the sensor, it is recommended to use the index, middle, or ring finger, toe, or foot. Once the sensor is placed, if signal quality is low, check for the following conditions: sensor position and size to ensure good fit, connection to the monitor, and if the skin is warm and has good blood flow. You can also select a different finger or location for measurement. If capturing additional parameters, begin by pressing and holding the bottom tile. Once the window appears, you can select the specific parameter from the list provided or type in the value and select the OK button. These values will be defined by the facility, and some may be required to fill before vitals can be sent to the EMR. If so, a star will appear next to the parameter. Now that the patient's vitals have been captured, selecting Save will transmit the vitals directly to the EMR and also save into the Review tab. The Save button will perform differently based on how the device was configured. Please consult your clinical administrator for more details on your specific facility. Next, we'll cover the intervals profile. This profile is commonly used to monitor a patient for a defined period of time while treatment or care is being delivered. Unlike the spot profiles, intervals contains alarms which can be adjusted by simply clicking on the bell in any of the parameter tiles. To set a specific intervals protocol, click on the clock icon located in the NIBP tile. From here, you can select which parameters you would like to run intervals on, NIBP or SpO2, and the rate at which you want to take intervals measurements, for example, every 15 minutes. You are also given the option to build a custom intervals program by toggling from automatic to program mode in the button that resides immediately above the SpO2 and NIBP selection boxes. Custom interval programs are often created to meet specific facility protocols. More information on how to set up this advanced feature can be found in our other resources, such as the Instructions for Use manual. Once you have set your alarms, selected the parameter you wish to monitor, and made an interval protocol selection, you are then ready to use this profile. To begin an intervals measurement, select the blue Start Intervals button located in the Intervals program screen. As measurements are taken, the device will record them in the Review tab for reference. The most current reading will be displayed in the parameter tile until the next interval measurement is taken. To stop intervals at any time, click on the clock in the NIBP tile and select the Stop Intervals button at the bottom of the screen underneath your parameter selection menu. Finally, let's review the continuous monitoring profile, which is designed to continuously monitor a patient. This profile also enables you to take manual temperature or NIBP readings, to use alarms and timed intervals, and to use bidirectional controls to transmit data between the monitor and a central station. The content area of the screen will dynamically adjust based on the configuration of the device and peripheral accessories attached. To begin continuous monitoring, first be sure you're in the continuous profile, and then begin attaching the sensors to the patient. The screen will begin to populate as readings are acquired. In this profile, measurements are automatically saved as follows. Continuous measurements such as SpO2, pulse rate, EtCO2, and respiration rate, and are saved once per minute. When any measurements fall outside of alarm limits, all continuous measurements are saved. NIBP and predictive temperature measurements are saved when acquired. Manual parameters are saved when you touch OK on the Manual tab. Modifiers are set when you complete parameter setup and return to the Home tab. These modifiers do not appear on the Review tab. After 24 hours of data has been saved for the selected patient, any data older than 24 hours is deleted from the monitor. To begin ECG monitoring, plug in the USB of the ECG module into the bottom of the device. The screen will automatically change to show an ECG tile at the top of the content area. Next, attach the 3 or 5 leads to the patient, following proper lead attachment procedures. More information on proper lead preparation and placement can be found in the Directions for Use manual. Once the patient has been hooked up, touch Start in the ECG frame to begin acquiring an ECG waveform. Allow 3 to 5 seconds to pass before the waveform appears on screen. The heart rate will also appear in the ECG frame. Locate the ECG lead label in the frame. Look for a list of available leads with the current lead selection highlighted. To display a different lead, touch the screen anywhere on the waveform. The waveform and lead selection label change with each touch. You can save snapshots of non-alarming waveforms to the Review tab. Non-alarming waveform snapshots capture 7 seconds of data before the request. Please note you can capture 1 waveform snapshot per minute. When you observe a waveform you want to capture, touch the camera icon in the ECG frame. A Snapshot Save Successful message appears to confirm a successful waveform capture. Next, navigate to the Review tab and observe the saved waveform icon in the ECG row. To open and review the waveform snapshot, touch the ECG icon. Select Print to print the waveform if your device has been configured with a printer, or Cancel to close the snapshot. Both selections return you to the Review tab. Arrhythmia, VTAC, VFib, and asystole alarm waveform snapshots are saved automatically to the Review tab without user action. If Print on Alarm has been enabled in advanced settings, the waveform prints automatically after saving is complete. The saved waveform icon for an alarm condition appears red in the Review table, indicating a high-priority alarm. Alarm waveforms capture the 7 seconds before, as well as the 7 seconds after an alarm event. During the 7-second post-alarm save time, you cannot modify any settings such as leads, filter, gain, and pacemaker detection. Continuous monitoring can be paused at any time by pressing the Pause button. Once finished with patient care, turn the CVSM off, or put it into sleep mode by pressing the Power button and select the relevant option from the on-screen menu. Thank you for watching our in-service on the Connex Vital Signs monitor for acute care. If you have any additional questions, please reach out to your local Baxter representative for more information.